This video is not a replacement to your owner's manual. Please refer to your owner's manual for additional information. Be sure to never alter slings, as they are a medical device. It is strongly recommended to have a sling assigned to and stay with each resident. This ensures that it is the right type and size for the resident. It also reduces the number of times that the sling may need to be laundered, which prolongs the life of the sling and ultimately cuts down on costs. Laundering instructions are printed on each sling label. Wash at the recommended temperature in any washing machine. Never use detergents that contain bleaching agents. Mild detergents and disinfectants are recommended. Slings can be air-dried or dried at low temperature. Be sure to inspect slings before each use. Bleached, torn, cut, frayed, or broken slings are unsafe and could result in injury. Discard them immediately. Practice transfers often so that you become proficient and comfortable before you try to lift a resident. Practice lifts from bed to wheelchair or chair, from chair to bed, and floor to bed. Read and understand the sling owner's manual before use. Safety is most important when performing lifts, and that includes your safety. Always use good body mechanics. Keep your center of gravity low and use your leg muscles when positioning the resident. Place your feet apart to establish a broad base of support. Keep your spine in natural alignment and never twist while lifting.